Hello, everyone. My name is CJ Falahoon,
And my name is Harsha Mohan.
and we are Ai-Ris. So one of my co-founders and close friends grew up in a part of India where access to healthcare is limited. And his grandfather, Mr. Rao, lost his vision at the age of 58 due to diabetes. This is a man who loved to work with his hands and explore the outdoors, who could no longer live the life that he wanted to. Mr. Rao's blindness was due to a condition known as diabetic retinopathy and could have been easily prevented with access to adequate eye care. Unfortunately, individuals living in rural areas and underserved communities don't have access to this eye care. At Ai-Ris, we are addressing this problem with a low-cost retinal imaging system that consists of a headset camera and a machine learning algorithm that enables us to offer quality eye care in almost any location. We plan to offer our technology to primary care physicians who work in rural areas and underserved communities who regularly treat diabetic patients. When a patient is positively tested with diabetic retinopathy, they are then referred to an ophthalmologist who can offer more in-depth vision care services. There are several key advantages of our system. Firstly, it's portable, which makes it ideal for the use in low-resource environments. Secondly, our machine learning algorithm enables non-specialists to use our service. Lastly, the ability to send images remotely make our technology perfect for the use for telemedicine applications.
There are two classes of devices currently used for screenings: handheld systems and tabletop systems. Ophthalmoscopes, while portable, do not allow for digital image capture. Slit lamps are bound to the table and are typically only found in optometry and ophthalmology clinics. OCT machines are extremely expensive devices only found in upscale clinical settings.
Over 11 million Americans suffer from diabetic retinopathy, and this condition is exacerbated in rural areas and underserved communities where the prevalence of diabetic retinopathy is higher, while the access to healthcare is lower. But we're not directly selling to these individuals. We're targeting the primary care physicians who reside in the US, who are over 250,000 in number. Specifically, we're targeting those who work in rural areas and underserved communities, who amounts to the about 76,000 in the United States.
We will give the device to clinics at no upfront cost and charge a monthly fee for unlimited uses. The clinics have an incentive as they can bill the patients per use. We're assessing a tiered pricing model where the monthly cost of the clinic is a function of the reimbursement rate and serviceable patients. This will allow us to reach underserved communities while also maintaining the economic viability of Ai-Ris. We're in discussion with clinicians at Baylor College of Medicine and Johns Hopkins School of Medicine for a pilot study. The pilot study will be our method to establish trust and relationships with the clinicians at these institutions, and we'll then leverage these connections to reach out to our target market. We have formed an entity and are working on our first prototype. We will file a provisional patent by the end of August 2020. Rolling into the spring, we will gear up for a pilot study in preparation to file a pre-submission to the FDA as a Class 2 device pursuing the 510(k) pathway. We are a diverse team from a variety of disciplines with the drive to bring fundamental eye care services to all. We're seeking an advisor with experience in medical reimbursement and FDA regulation. We're also looking for clinical study partners from academic institutions, and we're also looking for early adopters in the form of primary care physicians to help us rapidly iterate on our product. At Ai-Ris, we are determined to bring quality eye care to underserved communities. Thank you for your time, and we look forward to speaking with you in the breakout room.